to go?
Good.
Well, good afternoon. As we have reported, we have only 3 new cases in Queensland, all overseas acquired and in hotel quarantine. In addition, we've had 5,956 tests in the last 24 hours. So once again, we thank Queenslanders for coming out and getting tested, and we ask that that testing continue, and that is more important than ever now that we are aware of some cases in New South Wales. And we currently sit at 20 active cases, and Queensland has delivered over 152,000 vaccines in addition to the Commonwealth's vaccinations here in Queensland. Now, New South Wales has reported yesterday afternoon and have just updated that they have 2 locally acquired community cases. Now, although they have been able to identify the original source being an overseas traveller, the New South Wales Premier has indicated today that there is a high likelihood of at least 1, if not more, people in the community that also have the virus. They don't know where those people have been and how long they've been infected. It is important that we do everything we can to ensure that people who have travelled from New South Wales to Queensland, that we're keeping everyone safe. That is why last night we advised that anyone who has been to any of those venues in New South Wales immediately quarantine, either at home or other accommodation that they're at, for 14 days and get tested. What we will also now be doing is from 1 a.m. tomorrow morning, anyone who arrives from New South Wales who have been to any of those venues at the prescribed times and dates, that they will need to go into hotel quarantine. So we ask that people shouldn't be travelling from New South Wales who have been to those venues. They should be following the advice of the New South Wales health authorities. But anyone who does arrive from 1 a.m. tomorrow morning who has been in those venues will go into hotel quarantine. And we will have police and health workers meeting flights coming into Queensland to just check with passengers whether they have been at those venues. We also understand that this list of venues is likely to be increased. So anyone who has been in New South Wales since the 27th of April, we ask this of you. If you have any symptoms whatsoever, please get tested. If you arrive after 1 a.m. tomorrow and while you are in Queensland, identify new venues that you have been at, please immediately quarantine and call 13 Health so that we can put in place arrangements to quarantine you in hotel quarantine. This is to protect you, to look after your safety, but of course also to look after the safety of everyone in Queensland at the current time. We believe this is sensible restrictions at this time, and of course we will be watching and monitoring very closely what is happening in New South Wales, and Dr. Young, of course, will be continually talking with her interstate colleagues, including New South Wales, about how their testing is going and any new information that comes from that. I'll now hand over to Dr. Young just to talk about the 3 overseas cases that we have and also the New South Wales restrictions that we're putting in place. Dr. Young.
So we had 3 new cases detected in hotel quarantine overnight, 2 of them travellers from PNG and 1 a traveller from Nepal. We had a lot of testing occurring, which was great to see, and it's really important that we increase that testing because of the risk that is posed to Queensland with this outbreak that's happened in Sydney. So please, anyone who has been in Sydney from around the 27th of April onwards, if you develop any symptoms at all, it's critical that you immediately come forward and get tested. We've seen time and time again people do exactly that, and we've been able to pick up clusters before they even start. So please, anyone with any symptoms at all, or you're not even sure, just come and get yourself tested. Now, if you have been to one of the 19 venues listed on the New South Wales website, you need to not only get tested and isolate till you get a negative result, but you need to ring 13 Health so it can be determined what you need to do next. For other people who haven't been to those venues, they only need to isolate till they get a negative result. So that's important. then I do want to mention something else. So TGA later today, I understand, is going to go out and announce a case of thrombosis following AstraZeneca vaccination in a 66-year-old gentleman in Townsville. So he has been admitted to the ICU in Townsville, and TGA has confirmed with me that they believe that his illness is a direct result of the AstraZeneca vaccine. He received the first dose of the vaccine on the 30th of March, subsequently developed some abdominal pain and presented to the Townsville Hospital where he was admitted and tested, and it's now being confirmed that he has most likely developed that syndrome. So, of course, my thoughts go out to him and to his family at this very difficult time for them. Thank you.
Questions? Sure. Look, new information obviously has only just come to light in the last hour when New South Wales Premier stood up and advised that there was a second case. The second case isn't necessarily concerning because, of course, there were close contact, I believe, in the immediate household. But, of course, with a second case means there's going to be more venues and there's going to be more contact tracing. So we are concerned when there's any community transmission in any jurisdiction. We are concerned. We believe that at this stage the restrictions we're taking are reasonable and proportionate, but we will be watching very closely what happens with the testing and whether New South Wales are able to identify how this first gentleman was able to acquire the virus, having not come into direct contact with this overseas traveller. So that is concerning. But at this stage, we believe that the best measures is simply asking everyone who has been to these venues, remembering if you've been in New South Wales any time since the 27th of April, check the Queensland COVID website, check the New South Wales COVID website, and check for venues on a daily basis, because there will be new sites that will be added, I suspect. And even though today you may have not attended any of those sites, you may find additional sites tomorrow or following days. So we believe that today, we believe the restrictions that we're putting in place are sufficient, but we are willing to go further if we need to, as we have before. We know New South Wales are putting in restrictions as of 5 p.m. this afternoon. We certainly support those restrictions, and we know that the New South Wales Premier has already asked that the citizens of New South Wales start complying with those restrictions now, not necessarily wait till 5 p.m. So we would say to people in Queensland that if you were considering travelling to Greater Sydney over the next few days, that you should consider your plans because we don't know what's going to evolve over the next few days. Look, at this stage, as I say, anyone who identifies as having gone to those venues, they'll be quarantining for 14 days. But we will see how New South Wales goes with their own restrictions. I believe they've announced them for 3 days at this stage. We will see how they go with their contact tracing, with their testing, and trying to identify this missing link or links, and then we'll be in a position to have a better idea of how long the restrictions should apply.
Just to clarify, so the government will consider border closure or hotspots if the situation
But at this stage, all of that's hypothetical, but we have responded, and we've responded consistently whenever there's a transmission in other jurisdictions. At this stage, because of the small number, we are limiting it to the venues. But if there are border cases, and if Dr. Young recommends that there needs to be hotspots of areas as opposed to just venues, then of course we would follow that advice. Look, we will always act on the advice that we're given, but also, and we've said this from day one, every case stands alone. We have to look at the circumstances. Now, as I understand what the New South Wales Premier has just said, this is not a case of the UK variant. We know the UK variant is much more contagious, and so we have responded differently when there's been the UK variant in jurisdictions like we saw in South Australia and Western Australia, and of course here in Queensland. At this stage I understand it's not. I believe it's the Indian variant in which there isn't that evidence of it being more contagious at this stage, but we'll watch very closely. No, not at all. This is Queensland acting on the advice of Dr. Young and her amazing team, as we always do, and we have from day one.
The governor's 66-year-old case, does that add any more concerns to you about the AstraZeneca vaccine?
Oh, look, we'll continue to follow the advice of the TGA, and if I can say, this is why we have said, and Dr. Young and I have both asked the Commonwealth Health Minister, that we believe that the GPs who are on the National Immunisation Program should be the GPs that are administering the vaccine to the broader community, because they know their patients and they're able to have that conversation with their patients to ensure that there's informed consent. They are in the best position to do that. So we've asked that they broaden the number of GPs. We understand at the moment there's limitations to that because of supply. But when there is sufficient supply of AstraZeneca, then they should be providing that to a much broader range of GPs, all of those GPs who are currently on the immunisation program, because individuals will have much more confidence about making that informed decision when they're actually having that conversation with their own GP.
Are you concerned about what impact these cases would have on, I guess, the vaccine hesitancy?
Oh, look, vaccine confidence is really important. We want as many Australians and Queenslanders to get vaccinated. We know that that is really important to protect our community, and it is one of the ways, and an important way, to open up our whole economy. And we will continue to act on the advice of the TGA. Let's wait and see. We're getting exactly the same questions about Western Australia and the Reds playing their game. And guess what? The Reds are playing their game this weekend. So let's just wait and see how well the restrictions New South Wales are putting in place work, and whether they get any additional cases and whether they're able to link those cases or not.
If there are players who are deemed by New South Wales to be contacts, they then need to stay in quarantine in New South Wales. That's what New South Wales has come out and said. So I support them in that decision.
Do you have any updated advice about people over 50 receiving AstraZeneca given it's now 66%?
Yeah, so it hasn't actually changed the advice. So TGA, I understand, is coming out this afternoon with a statement. So it's important to see what that statement says. I haven't seen it at this stage. And at this stage, the advice is that people who are vulnerable should get vaccinated with the AstraZeneca vaccine if they're 50 years of age or over.
The Premier said that there's a Pfizer hub that's going to be set up in Rochester that's now getting rolled out. Is there any update, any more locations when these Pfizer hubs are set up?
Yes, so we should have Pfizer hubs rolled out throughout the state by the end of May. So every single hospital and health service will have at least one hub.
And when's the rollout restarting with Torres Strait? I thought it was taken away.
The 17th of May. So their freezer has arrived, so they're just finalising arrangements.
Dr. Young, would you concede that, say, about 6 or 8 months ago, a case like this would have triggered a lockdown or a border or a hotspot? water closure at hospital?
I don't think we had a single case back then. By the time we knew about an outbreak, we had a lot of cases. We're in a totally different situation now. All of the states and territories are really, really quick to act and to find cases at the start of an outbreak. And I'm hopeful that's what's happened here. We'll just have to see how it unrolls over the next 3 or 4 days.
What would it take you to declare a hotspot in one of those areas?
Uncontrolled spread.
Is there any update on the investigation that's going on at the PA about how the 2 separate networks?
No, I haven't received any update at this stage.
When is that expected to wrap up?
They've done a lot of work, so the advice was that they couldn't find anything that had been done wrong by anyone. Everyone had followed processes and procedures, and they was going to do a bit more work looking at airflow.
And will that report be made public like the Grand Chancellor report?
It's been an internal review, so that will be a decision by the hospital.
They're just talking about the pressure on emergency departments. I know you've spoken a lot about it. In order to kind of free up some more beds, the together unions willing to work to be fast-tracking the Cairns hospital. Is that something you consider?
Look, we're moving very quickly on the enhancements we're making at Cairns Hospital. The land is already there for construction to start on the mental health unit. I believe in the next couple of weeks we will have the work that's been done, the due diligence work being done on identifying sites for the new Innovation and Research or Education Centre. Now, why that education centre is important is because currently all of that research and education is happening inside the hospital. So once we establish the land and build the centre and move those services out, we're going to immediately be able to create extra bed capacity. I think it's around 30 bed capacity through the education centre and another 70 through the mental health, so 100 extra beds. So we're moving as quickly as we can. As I say, I'm pretty sure it's the next couple of weeks we'll have the sites identified where we could build the education centre and then move quickly to try to actually procure a site and progress that development.
Do you think the PA should make the report public into the
Sorry? Look, we will certainly advise the public, as we have at every other occasion. We'll advise them on the findings. But the findings so far have shown no direct or deliberate breach by any staff. What we have said is the work that's being done now with the internal review is about the environment. So it's not, the work that has already been done about staff. Just as the Grand Chancellor, we found that there was no direct breaches by the staff on that occasion. Now we're looking at the environment. Is there something about that ward that led to a transmission and, as the Chief Health Officer has said, maybe to do with airflow? So we will certainly advise the public when we have those findings.
Okay,
Thank you.
I'm wondering what's going on with you.